So I am the executive director of People's Health Clinic. We provide health care for the uninsured in Summit and Wasatch County. And the why, that's the biggest question, is working for a nonprofit. It is the best and hardest job I've ever had, but I do it because every day I get to feel like I help people, that I help them navigate a system, find resources, improve their health. Sometimes we find people who have cancers and we assist them in their families getting the help they need. So I do it because someone has to, and it's important, and I feel better when I have. We provide health care for the uninsured in Summit and Wasatch County. So if you are uninsured and you live in our area and you can prove that you live in Summit or Wasatch County, then you can come and see us at the clinic. We really are pushing every day to make people aware that we exist and that they should make us their health home. We believe that everyone deserves quality health care, not just those who can afford it. And that's what we want to be for people, is we want to be their health home. There are 8 free clinics in the state of Utah. We have an organization called the Utah Association of Free Clinics. I'm the president of that organization, and we get together on a regular basis to discuss just that, is how do we get people to reach out to us. And there's a little bit of a stigma sometimes attached to free clinics, and we want people to know that the only reason we exist is for you if you have no insurance, and we provide quality care from retired and volunteer doctors. Most of us have no paid physicians. It's usually done by very overqualified physicians, providing you some of the best health care that you can get in this state at a free clinic. I think that being responsible for your own health means being your own advocate, not waiting for someone to be an advocate for you, but to go out and find your resources. There's many things available in our communities right now for most people to find where they can find health care, housing, better education, where they can find ways to find food, which is important, and mostly just a resource for anything you need. It's out there. We just need to be our own advocates and find that. And I think the best way to be your best advocate is, if you don't know something, because we don't know what we don't know, ask. Navigating the health system is difficult. They don't make it easy for you, but there's help out there. I would first go to utah.gov, and if you qualify for some of their assistance programs, then that's the way to go, because I tell people all the time, if you can have insurance, you should. So first go to utah.gov. If you don't qualify, then go online and find one of those free health clinics that are in the state that are closest to you. In Park City, it would be People's Health Clinic. In Salt Lake City, you would have the Maliheh Clinic or the Midvale Community Clinic. Down in Provo, you have a clinic. In St. George and Moab, you have clinics. So find us. Just to do a Google search of Free Clinics Utah, and we'll pop up. So Medicaid expansion will have a significant impact. We currently have 200,000 individuals in the state of Utah who have no form of insurance that could be insured. So, and that should be insured. And so this Medicaid expansion that we currently are looking at will aid the residents of our state by giving them access to services that they have not had in years. And unlike other states that have fully expanded Medicaid, we're still going to leave some people behind. But at least we're going to fill some of that gap, because anyone who is not on ACA and not covered by any form of insurance, we consider them to be in a gap of coverage. So this Medicaid expansion will assist those people, especially young families, single mothers with children, or anyone with any sort of disability, anyone who currently cannot afford to have insurance through ACA, but is eligible for the Medicaid expansion bill needs to go in, get the assistance on how to apply for it, and get covered. And get covered now, because the sooner you start taking care of yourself, the better you're going to be and the healthier your family's going to be. So the wonderful thing about Medicaid is that it is a hand up just for what we assume will be a very short period of time. Once you're able to become healthy, able to provide for your family, to get employment, then we assume that you will be eligible for employment and insurance under that employer. The healthier you are, the more productive you'll be, and you won't have to stay on Medicaid. And that's the beauty of the Medicaid system, is that people don't get on it and stay on it for life. It's just for a short period of time until they can provide better for their families and become healthier. There are, including obviously Medicaid and Medicare, wonderful resources for especially anyone with special needs. If you have a special need, you're probably going to know about those resources, but there are some that you may not know about, like Baby Your Baby, or there's a program called CHIP. So that's the Children's Health Insurance Program. So if you have a child and you may not be covered under insurance, but your child can be covered under insurance. So I implore you, look up every resource you can, how to get your child covered, because under CHIP, not only will you be able to make sure that they get their yearly annual physicals, but they're also going to be able to get dental checkups and eyeglasses. And that's so important, because if a child can't see or if their dental health is not good, they're not going to be able to learn. And most people in my clinic, the biggest need is dental. Because whenever your mouth is not healthy, your body's not healthy. It's definitely an indicator of other forms of health. So for seniors, Medicare is the best choice. As I get older, I look forward to being on Medicare. I think it's the best thing we have. All insurance, there's Part B, which is expensive, and there is help in paying for that. And again, if you go to us.gov, there's a very, very good program that will actually teach you how to get on to Medicare. There's also there's something most people don't know as they get older, is that you have to apply a year before you go on to it. So you need to do that even if you're not 65. If you're 64, you should already know what you're going to be doing in the following year, because it's very important. Do all of your research now. I recommend to everybody, by the time that they're the age of 60, they need to know when they will start looking and accepting Social Security, when they'll go on to Medicare, when they will do all of those. As we age, we need to have all of these things written down, because you have to hit these timelines. And if you miss them, you have to wait an entire year before you're covered. So it's very important that you know. You don't wait for your 65th birthday. You go in now and do the research. The way to find a specialist in the market, if you're insured, you would call your insurance carrier and you would ask for an insurance navigator to help you find the care. A lot of the information is available online. I find it easier to make that phone call. You'll have to sit and listen to nice music sometimes and wait for them to get to you, but the insurance navigator would be able to tell you who under your insurance is covered. You usually don't want to go outside of your network. It tends to get more expensive. So if you stay in network, these specialists are provided through your insurance company. If you're not insured and you need a specialist, I know that at free clinics around the state, we work with volunteer providers, and we can find a specialist for you through our resource coordinators. There are basically three places to access health care. There is the emergency room, where you'll go if you're having a heart attack or if you've broken a limb. There's the urgent care in your neighborhood, where you would go if you're suffering from the flu, or if maybe you think you have strep throat and need to get a rapid strep test. And then there's your community free clinic, where you would go to if you have a chronic illness like diabetes or prediabetes, where you just need to go once a month and let us check your blood and make sure your A1Cs are in line. Or if you're a prenatal patient, where you need to come monthly to make sure that the baby's healthy. There's two basic programs that we usually discuss, and that's Medicaid and Medicare. And people get very confused. Medicaid is for anyone who makes under the 138% of the federal poverty level, and you have to either be married with children or a single mother with a child that has special needs. The other program is Medicare, and Medicare is all age-based, or if you have a disability. It's so important that you take the time to find out what the triggers to enroll in Medicare are and what those ages are so that it doesn't catch you by surprise. So if you are 65 and you're just thinking about it, you've waited too late. You need to start at least at the age of 63 to start doing your research. There's a lot on the utah.gov as well as the medicare.gov. And if you go to medicare.gov, it will walk you through the process. They don't make it easy. It's not simple, but it is doable, and they have help out there. In the state of Utah, we tend to be healthier than most places, especially in little pockets. I think St. George, Park City, Ogden areas in the state are very healthy, and that's because they get out. They're exercising at least 30 minutes a day. They're watching their diet to make sure that they're getting the proper nutrition. My recommendation to most of my patients is some of it's cultural. So sometimes we eat what we're culturally drawn to, but cut out any processed foods, which don't go into a fast food restaurant. Watch your sugar and don't drink soda. Nutritional shopping is difficult because to eat better costs more, and I would love to be able to solve that for our underserved population. For better health, I recommend you shop on the outside aisles. Stay in your fruits and vegetables, and actually, if you're going to eat beans, stay away from the canned beans. Go with the dried beans. It's pretty easy. You soak them overnight, and then you cook them up the next day, and they're really a wonderful source of nutrition and protein. So I would say just stick to your outside aisles. And I understand that they are fresh food and vegetables right now are very, very expensive. So look for those resources in your city like food pantries. I know in Park City we have the Interfaith Food Pantry where you can go and get wonderful fresh food and meats at no cost to the person. A great way to keep the cost of your medications down is to seek out partners in low-cost pharmaceutical care. One of those is Walgreens. That's a great resource. They're very philanthropic and tend to assist. You'll have to fill out a little paperwork, but they will help you. Walmart actually has really great discounts on their pharmaceuticals. You could also go into one of the free clinics, and we have what's called a prescription assistance program, also known as PAP. If you come in and become one of our patients, if you need insulin or some other type of drug that you take on a regular basis, we will walk you through the process of finding these prescription assistance programs, and in a lot of cases, they end up being free for you. We also provide you with birth control methods at no cost. My best three takeaways, I think, would be first and foremost is be your own best health advocate. Take over your own care of your own health. Also, I would suggest that find out what resources are out there. There are ways for you to navigate this difficult system, and help is out there. So if you can't find it, reach out to one of the advocates that are near you. I would say the Utah Health Policy Project is a great resource. They can lead you to a resource for whatever that need is. Mental health is a big issue right now, and there are some mental health advocates out there. Google search is one of the best. And then I would say that taking better care of yourself, living your best life possible begins with you and making healthy choices. What I'd like to challenge you with is to be the very best you can. Live the best you can and be as healthy as you can for you and for your children. And the best way to do that is to live a healthy lifestyle and everything in moderation. And remember that you're only as good as the food you put in your body and the exercise you get.